and they can come out and give an estimate of first how malnourished you are at the cellular level of these nutrients, and second, some people need less and some people need 3 or 4 or 5 times more.
There are some new methods being used by some chiropractors called NET and TBM. This is neuro-emotional training and total body modification. Some patients who have had these methods used have found that they no longer need allergy extract treatment, they no longer need a diet, they no longer have trouble with chemicals. I'm not saying that it's a cure-all, but I'm saying there's a splinter group of chiropractors that haven't done any scientific research to document what they're saying, but their methods appear to help some children.
There have been a number of studies on EPD in the literature. One of the latest ones was in 1992 in the Lancet, a prestigious British journal, which looked at EPD in hyperactivity in children. And they looked at 20 children, and the EPD was found to be effective in 16 of the 20. They compared it with placebo, in which there was an effectiveness in 4 out of the 20. So this was quite a significant response. And the nice thing is, in these children who had food allergies, they were then able to, after a certain period of time, go back to eating some of those foods and without the adverse effects of the hyperactivity.
Everyone has to sit back and look at their medicine cabinet and say, do I really need all these medicines? Did the doctor tell me what's really wrong with me? And did I ask, why do I need the medicine? Why is my blood pressure elevated? Why is my nose stuffy? Why do I have asthma? Why do I have arthritis? The answer isn't a better, more sophisticated drug. The answer is to find out what's causing the problem and get rid of the cause.
One of the conditions that surprised me that responded dramatically to food allergy, in about 3 out of every 4 cases, was inflammatory joint condition called rheumatoid arthritis. I had one patient who came to see me. His name was Bill, who had suffered with rheumatoid arthritis for 5 years. The year and a half prior to coming in, he had been in and out of the hospital, had spent something like $115,000. And either the first or second visit that he came to my office, he emptied a brown bag filled with over 100 empty prescription bottles that he, involving prescription drugs that he had used in the attempt to bring this extremely disabling pain and swelling and stiffness under control. He had suffered from complications, GI bleeding, cataracts, all kinds of complications as a consequence of this approach. He was a skeptic, didn't believe what I was advocating. His wife happened to have some knowledge in nutrition, so he gave it a try. Without adding medication, in fact, by decreasing medication, anti-inflammatory medication, within the first 3 to 4 weeks he was pain-free, where before he was in so much pain that he couldn't even put a sheet over his body to sleep at night because the pain was so severe. He was pain-free within the first 3 to 4 weeks of the therapy. And within 3 months, I had the opportunity, maybe the honor, to actually see him get up and take the first step out of the wheelchair that he had taken in 18 months prior to coming into the practice. Now, what did we do? We primarily approached his condition as a nutritional food allergic disease. And by focusing on just improving his overall nutrition, rotating his diet with a wide variety of organic foods, and getting rid of allergic foods from his diet, he was able to heal within a period of 3 months from a chronic disabling condition called rheumatoid arthritis.
A study by Yale in February '96, they were still saying that sugar doesn't cause hyperactivity in children. It takes a long time for the medical profession to start to even bend a little bit.
I really believe with all my heart that you can make changes in your life, learn things. Knowledge is power, and with understanding you can then increase your faith to do something in your life. But without knowledge, how are you going to understand everything? Become informed. Don't expect your medical doctor to be an educator or a teacher for you. Go out and do these things yourself. Do some research. Talk to other physicians. Talk to naturopathic physicians. Talk to chiropractors. Talk to people who are well versed in nutrition so that you can get input and then make an intelligent decision yourself.
I have found that it's opened up a world for me, and now I'm interested in a lot of things because I've had such a positive experience with this. I like the momentum, so I'm experimenting with other things, as I said, exercise and aromatherapy and massage, and it's all having a positive benefit, and I think it just started with just changing my diet.
What we must understand is that the old notion of what an allergen is, how it affects us, has to be updated. There's so much new information showing us that almost every part of our lives could be affected by the quality of the environment in which we live, our immune system's response to it. How we can identify these allergens, how we can cleanse the body, rebuild our immune system, well, that's what this program was about. Hope that it gave you the information you need to start your own journey. I'm Gary Null. Thank you very much for watching.